Welcome back to part 4 in this series. For those of you who didn't see the last few videos, my name is Emma Gatehouse and I'm the Behaviour Resident here at Langford Vets. Earlier in this series, we discussed how stress can have a direct effect on body systems and disease processes. Now we're going to consider how different physiological diseases can present behaviourally and how their variety of behavioural outputs can be useful in diagnosis. Endocrine disorders can lead to significant behavioural changes through hormonal alterations. When we see changes to reproductive hormones such as testosterone, estrogen and progesterone, we can see a wide range of presenting behaviours, as they have effects on different neurotransmitters such as dopamine and serotonin, and also mood stability. Another common disease process leading to behavioural change would be thyroid disease, typically affecting cognition and activity, including exercise and feeding activities. Thyroid hormones also influence neurotransmitter synthesis and the limbic system, having a direct effect on behaviour and mood. As mentioned, animals with thyroid disorders can have significant behavioural changes, such as increased vocalisation and agitation, which can lead to increased frustration, as well as effects on feeding behaviour. Care needs to be taken not to overestimate the prevalence of hypothyroidism in dogs, but dogs with this disease could show mood changes such as apathy or irritability. Careful monitoring and treatment of thyroid diseases is required to ensure that over-arousal does not occur when we are altering the hormone imbalance in the opposite direction. Patients with adrenal disorders may present with behavioural signs associated with chronically altered cortisol levels. Cortisol impacts normal sleep-wake cycles as well as stimulating appetite. Irritability or aggression may result if frustration around access to food or adequate sleep develops. Urinary behaviours may be altered due to the presence of polyuria or polydipsia. If cortisol is too low, then fatigue, electrolyte imbalances, and an inability to cope with stress may also occur. It is important that behavioural signs be used as a diagnostic tool and an indicator of disease stability to support these patients. Diabetic animals will typically be polyphagic and polydipsic. Their increased desire to eat and drink may present as a concern in companion animals if the animal becomes frustrated and aggressive in response to limited access to these resources. House soiling with inappropriate urination may also be a presenting complaint, so it's important that we as clinicians can recognise these behaviours as indicators of possible underlying disease processes such as diabetes. As discussed in part 2 of this series, we can see gastrointestinal changes secondary to chronic stress. However, gastrointestinal disease can also cause significant behavioural changes in our animals. Behavioural changes such as increased irritability or aggression due to discomfort may occur with visceral pain. Apparent behavioural signs such as excessive licking, flank checking, stretching of the neck and stargazing behaviours may also be indicative of underlying GI discomfort and disease. Managing and investigating this in cases presenting for behavioural consultation is important in order to treat and manage the root cause. Management of dermatological disorders in our companion animals is important due to the significant effect of itch and discomfort on the animal. Disruption to sleep and rest is common in animals that want to itch continuously or cannot get comfortable in order to sleep well. Self-trauma with the release of endogenous opioids can be inherently rewarding to animals who are licking or biting at themselves, perpetuating the cycle of these behaviours. We need to address any underlying concerns when these patients are present in order to see significant improvement in itching, self-trauma or biting behaviours. Feline psychogenic alopecia is a diagnosis of exclusion identified with the presence of clear behavioural triggers following dermatological investigations. In the majority of these cats, an underlying dermatological reason for itching, scratching, biting or self-trauma is identified, such as allergy or atopy. And so it is important to ensure these cases are worked up thoroughly before pursuing behavioural modification. If other causes of alopecia have been excluded, then environmental modification and reduction in exposure to stressors, as well as psychopharmacological support, should be considered. Again, acral lick dermatitis is likely to have inciting factor or cause which may lead to pain, discomfort or infection, which leads the animal to groom or pay more attention to the area. Grooming may become excessive and repetitive in response to stressors as a result of endorphin release. This helps to reinforce the behaviour further. Significant medical causes need to be investigated and treated if they are present, as they are likely an initiating trigger. Then, providing outlets, redirecting grooming behaviour and resolving causes of stress should occur alongside medical management. Hepatic and renal disease may lead to changes in behaviour, which occur due to alterations in oxygen perfusion to the brain or altered blood flow, such as portosystemic shunts. Toxic effects may lead to abnormal behavioural presentations, which indicate a need for further investigation. Behavioural changes within previously stable patients can also be an indication for a changing disease profile or destabilisation. This is the end of the video, and in the next video we will discuss some take-home messages and way that behaviour can help us with our diagnoses.